I'm most proud of the connection that I make with my patients. And when it's the most difficult and then they understand and they make progress, that's when I feel that I did my job. We want you here at Kaiser Permanente, okay? We need you, we want you, we want to support you, we want you to have a wonderful practice. And if your goal, your heart is to serve the Latino population, we have that population here.
Growing up, I always knew I wanted to be a physician, probably from the age of 3 or 5. And it was clear to me when I started down the process that growing up bilingual, bicultural, that taking care of Latino patients in a large degree would always be very important to me in my practice. One of the reasons I came to Kaiser Permanente was because of the diversity of the members we take care of. I really didn't want to get slotted into one particular socioeconomic or demographic group. We take care of everybody. 21% of our patients in Northern California are Latino. In my particular office, half the women in obstetrics are monolingual Spanish speaking. When my grandmother was diagnosed with diabetes, she got a paper in English saying that she needed to stay away from mashed potatoes and white bread and such. And she said, great, I don't eat any of this stuff anyway. And I thought, no one talked to her about rice and beans. No one talked to her about food that was culturally correct. And I thought, that's something that I need to work on, that I want to be able to give the same level of care as if she were English speaking and had been born in this country. I work with the patients that I want to work with. I have great support from my colleagues. I've been invested in as a leader. I get to work in the community. And I really think it's the best place there is to work with Latino patients. You really should take a look at TPMG.
Latino patients are a fabulous group of population individuals that if we speak the same language, we can reach to them easier and better because we can understand the culture, the backgrounds, what they eat, what they do. That creates a lot of satisfaction for me since I can understand that we have a great system here. We have a fully integrated electronic medical record. At the same time, we also have a multi-specialty group practice. That really is very satisfying to me as a physician, and I will encourage any physicians that are very interested, especially to come and join us. It gives you the opportunity to have collegiality, and it really improves the practice and quality of care that we deliver. It's a privilege to work with the Latino population. Being here in the Kaiser Permanente Medical Groups, it gives me that opportunity where you can make a difference, not necessarily with your patients, but also with your colleagues and also the community as a whole. It really, being a Latino physician here, it makes me feel like I'm making a difference. That's the reason I'm here, because I really have grown as a physician, but also as a person as well. So I will encourage anyone that is interested into looking at that aspect of leadership skills, community service, teaching aspects, and also to work with an excellent group of physicians that are always striving to become better and better in terms of quality. This is the place for you to be.
Every day I feel like I get to give back to my community, which is, I think, something that a lot of Latino physicians want to do. That's sort of, I feel like, ingrained in us, that you always give back to our communities. It's kind of part of that mission, and I do feel like I do that, and I get the opportunity to do that here at Kaiser Permanente. I was really impressed when I first got here because the first day I was here, I wanted an abdominal CT on a patient, and at my previous job, it probably would have taken me at least a week to get it done, or sent the patient to the ER, of course, but I would have had to have gotten several staff members involved to get it. Well, for this patient, I got on the phone, I ordered it, she had an appointment by the end of the day, and I had the results an hour later. So it's really impressive how quickly we can get things done and get our clinical work done. And the truth is that a lot of the Latino patients are working poor, and they just happen to have a job where they can have really good insurance. And so they need providers like myself, like those of you out there who speak Spanish and who are culturally competent and aware and sensitive, to help them through our health system and this health system as well. So you can provide a really good service by working here at the Permanente Medical Group.
I came to Kaiser for a variety of reasons. Kaiser Permanente has a great reputation, first of all, for providing great care to our members. Kaiser Permanente provides the resources to me as a physician in terms of medical education, resources to care for my patients as well. In particular, I've always had an interest in caring for Latino Spanish-speaking patients. I have had the opportunity to enhance my Spanish language skills through sponsorships and cooperatives developed by Kaiser Permanente. I've had opportunities to work in the community with Spanish-speaking populations. We've been able to build partnerships with similarly like-minded community organizations to provide care for a Spanish-speaking population that are underinsured or uninsured, and that's been a real source of joy working with these community-based organizations that share a similar passion. The fact that I can speak Spanish and English does make a difference to the families. I can't tell you the number of times in a day that I am talking to a parent in Spanish, turn around, the child wants to talk to me half in Spanish, half in English, maybe fully in English, and I turn back around and talk to the grandmother in Spanish. And so the majority of my visits are a combination of English, Spanish, and Spanglish, frankly. And that's the way that I like it. The Permanente Medical Group is a great organization that really has the interests of the patient at heart. I've been in countless meetings over the last decade, and really all of them have centered around patient care and doing what's right for the patient. And so you can feel comfortable that if you're making the decision to think about Kaiser Permanente or to join Kaiser Permanente, which we hope that you do, that you're joining an organization that is centered around patient care and doing the right thing for the patient.